Thank you so much, ma'am, for the invitation and the kind words. So, I had a very, very interesting journey when I applied uh, for my fellowship because I was so confused and so lost, but finally found my way out. So, Singapore, being a small city, didn't have so many options like the US or Canada. There are 4 basic hospitals that run there, and basically 2 of them give fellowships, one being Singapore National Eye Center and another one called Tan Tock Seng Hospital, and also NUH. So, so some of the things that I actually didn't have any inclination for an international fellowship because I had done oculoplasty from the prestigious Arvind Eye Institute in Madurai. And I always thought, okay, after doing so many DCRs and lid procedures, I'm just going to, have a path. And finally what happened was, contrary to all the decisions taken by myself and at home, I had to get married, and my husband was in Singapore. And so I was still halfway through my oculoplasty fellowship, and I really didn't know what I was going to do. So then I decided, of course, after having got married, I thought, okay, let me explore Singapore. So I had completed my 3 parts of the ICO and 2 parts of my FRCS Glasgow, but my 3rd part was still pending. So I thought, okay, I didn't really decide much. I just sent a few mails to SNEC, HRs, and people I knew there, and just started doing a lot of talking. So I thought, where do I see after completion of the fellowship? I actually didn't think of neuro-ophthalmology till I entered Singapore. But then my husband and I wanted to be together. So we thought, why not? So we decided to see what are the pros and cons. So we thought, okay, maybe there will be some, a small area, a niche where I could find between oculoplasty and neuro-ophthalmology where I could maybe, take that path. There's so much common things like optic neuropathy, thyroid, optic nerve decompression, all these things, lot of dreams and imaginations. So we laid out a lot of pros and cons, and we decided, okay, do I really want to do this? And do I see myself somewhere after doing all this? So before you make any decision, I feel you should identify your goals. So I was very interested in neuro-ophthalmology when I was in Arvind Eye Hospital also, just based on some common referrals that we would get into the oculoplasty department. But I always thought it's a very difficult branch because there's so much neurology in it. But then I thought, okay, why not give it a try? So what do you want from the fellowship? So that was the first question actually asked to me by my mentor in Singapore. So, they always talk to an external person with the note that what do you want to take back to your community? They know they're not going to retain you. So they always check for your aptitude rather than how much knowledge you know. So all they want to know when you go for an international fellowship is, are you really interested? And how much knowledge do you want to take back and utilize in your own community? So the next thing I did was talk to a lot of people who did fellowships there. And that gives you a lot of light, because sometimes you just find somebody you can relate to who will actually give you answers to your questions. And the main thing is to put yourself really out there. You need to show them that you're interested. You are a foreigner after all. So, and then what will the fellowship cost you? So if you only do what you can do, you'll never be more than what you are right now. So always go the extra mile. And there's a huge lake of knowledge to get into and learn. And just one note on why neuro-ophthalmology. It is a very fascinating field with a lot of integration. There can be life-saving and vision-saving diagnosis. It involves a teamwork with a neurologist and a neurosurgeon, and there is some amount of intellectual satisfaction. But more so than anything, do you have the interest in your specialty that you want to do? And as a career for a woman, I would like to say my mentors really said one thing: you can save vision, you can save lives, and you get to be an unsung hero, because you're the final referral point. If nobody knows what's happening, neuro-ophthalmopinion. So as Oprah Winfrey says, passion is energy. Feel the power that comes from focusing on what excites you. So neuro-ophthalm has so much variety because there's so many systemic manifestations of so many things, varying from optic neuritis to compressive neuropathy to ischemic optic neuropathy. Sometimes it's, even myasthenia, all these random and multiple systemic disorders which will come for referrals to you. So these are some of the people that you can contact if you're interested in a fellowship. So these are fellowship coordinators who will take care of your application process while you're there. It is a very, very, very tedious paperwork process that's involved. It took me almost 9 months to complete it. So, and you need a lot of referrals from your mentors in India, and everything needs to directly go to the Singapore Medical Council. So there's no middleman involved. So everything is verified to the T. And as you know, in Singapore, it's A, then B, then C. They'll never jump from A to C. So you need all these things. And basically, it's a very intense clinical diagnosis, history, systemic approach of multiple conditions, a very, very good neuroradiology department and an electrophysiology department, and multiple platforms for education and research. And of course, I had a wonderful experience in the whole 1 year that I was there. And there I am, 3 months pregnant also after my fellowship. And there is always something more to learn, even for a master. So I think if anybody is interested, any extra learning always adds value to you at the end of the day. So there are, all the fellowships in Singapore are 1-year fellowships. And interestingly, because of the increased load of myopia in Singapore, they have a myopia fellowship also. And thank you so much for your